I'm Johanna Ralston, CEO of the World Heart Federation. The World Heart Federation is a membership organization of foundations and societies with a focus on low and middle income countries and reducing the burden of cardiovascular disease worldwide. We unite our members in reducing CVD and in elevating cardiovascular disease on the global agenda. The World Heart Federation was one of the founding members of the NCD Alliance. We came together with our counterparts in cancer, diabetes, and chronic respiratory disease to address not just the common risk factors that we all shared, the common risk factors of tobacco, unhealthy diet, physical inactivity, and harmful use of alcohol, but also the fact that collectively, while 63% of all deaths are due to non-communicable diseases globally, only less than 3% of global development health funding goes to NCDs. Therefore, there's a very significant gap between resources to address NCDs and the actual disease burden, and the disease burden is only increasing. The World Heart Federation felt it was very important to dedicate a significant portion of our efforts and our advocacy to coming together collectively with the broader NCD movement. One of the outcomes of our efforts has been the successful NCD summit in New York immediately prior to the General Assembly in September 2011. The focus of the September 2011 UN high-level meeting on non-communicable diseases was recognizing that non-communicable diseases, which include cardiovascular disease, cancer, diabetes, and chronic respiratory disease, really are development issues now. They've gone beyond just health. So this was not the World Health Organization, this was the United Nations convening this meeting, recognizing that NCDs, as they're called, stretch across all sectors. This was meant to bring together heads of state immediately prior to the General Assembly to address common solutions and set common goals and targets around addressing NCDs globally. The key outcomes relative to the UN high-level meeting on NCDs that are most directly related to CVDs, cardiovascular disease, were around, first of all, global leadership, addressing this as a global health issue, and then at the national level, assuring that countries have national plans which include cardiovascular disease. And then also setting targets around, for example, salt reduction, which is one way to very directly impact CVD. Ensuring access to the Framework Convention on Tobacco Control to help curb tobacco use, which is another key risk factor for CVD. And then addressing other risk factors, including physical inactivity and poor nutrition. What the meeting means for the cardiovascular disease community is it really brought together the community in a way that was really quite wonderful. We now have become advocates. We now have become activists in a way that I don't think has ever happened before. Now we have cardiologists who frankly, were concerned about issues of around science, who are now becoming advocates in their home countries, who reached out to their heads of state, their ministers of health and their ministers of foreign affairs, and said, this is really a critical health issue. We need your attention, we need your help. So a very different mindset, and I think that one of the ways that a public health movement becomes successful is when you transform your clinicians into activists. When a clinician who is treating a disease at the very late stage or at the presentation stage starts to say, why is this happening so late? What can we do to prevent this? What can we do at a policy and population level to start to do a better job of saving lives and reducing morbidity? The UN meeting on NCDs was really only the beginning, and I think it's a long-term process, a process that really, the next 3 years are going to be critical to ensuring the success of the political declaration that was agreed to by heads of state at the meeting, ensuring that those declaration components are met, to ensure that very specific targets are set and agreed upon by everyone, and that the resources required to implement them are provided. It will be critical to keep attention focused on CVD post-summit. And one of the key ways we believe is this army of activists that we've built. We now have really truly a CVD community globally. People working on the public health side of cardiovascular disease, people working on the clinical side of cardiovascular disease, and people working in prevention, all coming together and saying this is something that we have this political declaration. We need to make sure it's implemented. We need to keep the pressure on. We need to be a partner in the solutions. We need the resources, and really focusing ahead in particular on 2013, when the Millennium Development Goals will be renegotiated, ensuring that CVD is part and parcel of any plans moving forward. One of the critical ways that NCDs differ somewhat from communicable diseases is that the solutions to them, the causes and the solutions, lie outside of the domain of health. The causes of NCDs are related to things like tobacco use, unhealthy diets, physical inactivity, lack of access to essential meds, harmful use of alcohol. All of those actually are not within the health domain. And so similarly, the solutions need to lie outside of the health sector and need to be very broad and multi-sectoral. We need to work with agriculture, we need to work with transportation, we need to work with trade and tax around tobacco use, for example, and we need to create a health in all policies approach. So health has to be a component of every policy. NGOs will have a critical role in ensuring that there is a health in all policies approach post-summit to implementing the political declaration. They need to take leadership around educating others. NGOs across sectors need to work together. NGOs across sectors already are working together. That was one of the very special things that came out of the summit. We had environmental organizations, we had maternal and child health organizations, we had agricultural organizations, all coming together and saying NCDs are not just a health problem, they're everybody's problem, and therefore the solutions belong to all of us. The political declaration was remarkable, and we would like to take some credit for that in how comprehensive it was. We were very pleased with how long, in fact, it was, because there were so many different pieces, so many elements, and it showed the involvement and activism of so many different stakeholders. So from that point, we see it as a great success. However, we were very concerned that specific targets were really missing from it. Targets both in terms of time and in terms of numeric targets. For example, 5 grams of salt per person per day is one of the key targets that was in an earlier iteration of the declaration and now is not there. Specific time-bound targets around when certain actions will be achieved. That's why the work is only beginning. That's why the role of civil society is so critical. We are working hand in hand with the World Health Organization, with governments, and even with the private sector to ensure that there are specific time-bound targets that will be included as almost an addendum to the political declaration, that those targets will be agreed upon by member states next year at the UN General Assembly, and that we can then hold ourselves and each other accountable for achieving those targets. One of the next steps in ensuring the success of the NCD movement, which we've now started to see come together, is really bringing in the public, now helping the public to understand what an NCD is, because it's a term that really hasn't had much familiarity yet. We do have good champions like Lance Armstrong and others who've done a very good job of pushing it out there. Jamie Oliver, they took on advocacy and promotional activities leading up to the summit to educate the public about NCDs. We need to continue to find those champions and continue to work with them. We need to understand that there is an appropriate role, an ethical role for the private sector, for the food and beverage industry, for the healthcare industry, for the device industry and others in NCD prevention and control. Although there is not a role for them in setting policy, they have a very important role in implementing policy. So bringing together public and private sector is actually very much the role of civil society, and we see NGOs as taking a leadership role in that space.